From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and it's always fun to visit with Dr. Josiah Fitzsimmons from Vero Neuropathy to find out how we can get rid of your neuropathy pain, and we get a visit from the Animal Rescue League. Yeah. Kinsey Miller is here with a very special guest that you will meet in just a couple of moments. But Dr. J, thanks for being here.
Absolutely, thank you for having me.
All right, now we want to talk about neuropathy and what is going on in the body that causes these conditions.
You know, it's a fantastic question. That's why neuropathy is such a debilitating condition for so many people. They have no idea where it came from, how it was caused. For a lot of people, it could be prolonged levels of high blood sugar, with diabetes, could be chemotherapy, exposure to different toxins in medications, statin drugs, but no matter what the cause is, what's going on is it's a deterioration of the outer coating of the nerve. You should have this nice coating around your nerve that insulates your nerve. Think of your nerve system as like your electrical system. You should have that nice rubber coating around all your wires.
Right, yeah,
going to your TV and all the parts of your body. With neuropathy, that coating is actually being deteriorated. It's a progressive degenerative condition, meaning it's just going to continue to get worse and worse and worse. And that's when you start to get the numbness, tingling, aching, burning, all those awful sensations start to lose their balance.
Now, is this one of the things that if you start experiencing some of these things, it's just going to go downhill?
You're exactly right. It's a progressive degenerative condition. Once you get up over 20% nerve damage, that means your nerves are actually dying faster than your body can heal them.
Okay.
So it's just going to get worse and worse and worse, and the symptoms are going to continue to progress.
Now, is this an actual disease?
So it's not classified as a disease, it's classified as a condition, and so of nerve damage. And so like I talked about, chemotherapy, radiation exposure, prolonged levels of diabetes, as well as different medications like statin drugs like I talked about. Also lots of autoimmune conditions, hepatitis C, Lyme disease, different conditions like that can damage the nerves over time, high levels of inflammation causing that breakdown around the outer coating of your nerves, and that's when you start to get all the symptoms, and then it really affects the quality of your life. Then you don't want to walk, you don't want to do activities, and then the problem just builds and builds and builds.
Now, a lot of people that have this condition, they take medication. You mentioned medication. They take medication because of what they're feeling. That's not really good, is it?
No, absolutely not. So gabapentin, Lyrica, Cymbalta, these are really the most common medications, but they're actually prescribed all off-label. Some of them are for seizure medication, some for anxiety and depression medication. They're just trying to figure out how we can get any results with neuropathy with these different medications, but all they're doing is just treating the symptoms. They're not actually correcting the cause of the condition, but that's what we really specialize at Vero, is actually getting down to the cause, treating the symptoms at their source, restoring that coating around the nerve so that we can stop the progression of this disease and people can get their life back.
All right, how about we hear from one of your patients?
Yeah, we have an amazing testimonial. Dennis, he actually had been losing his feet for over, losing the feeling in his feet for over 30 years.
Immediately I started feeling the difference in a week. I come 3 days a week at first, and I do my therapy every day, light therapy and the water therapy. And boy, I could just tell the difference every week. It's just really impressed me. And it's such a feeling to feel your feet again after you can't feel them for so long. I mean, feel warm and cold, It's great. And it's affected me all over my body.
Now, yeah, you can get relief. You can get some treatment. You have a $49 special going on right now. Tell us about that.
Yeah, so biggest thing is people need to come in as soon as possible. Once you get up over 80% nerve damage, that's typically when you can never get full reversal. But Dennis, he hadn't been able to feel his feet for over 20 years, and we still got great results.
Right.
Even though the research is saying that that's typically not common, we see that happen on a consistent and regular basis in our office. And so we actually do an 8-point test in our office where we calculate down to the exact percentage of sensory loss in the hands or in the feet, and that way we can figure out exactly what's going on, come up with an individualized treatment plan to actually start reversing those symptoms, get your quality of life back.
Yeah, there's the number to call, 515-335-VERO. Just type out Vero on your keypad, 515-335-VERO, and you can get the relief. And also, how quickly can someone be seen if they get a hold of you?
The great thing is we have a brand new facility, 3 times bigger. We're adding doctors. Just had 2 more doctors come on board to try and keep up with the demand. So really want to get people in as soon as possible. Like I said, with a progressive degenerative condition like neuropathy you don't want to keep waiting because it's just going to keep getting worse and worse. It's not something that's just going to stabilize or plateau or get better on its own. It's absolutely going to continue to progress. So you need to get in as soon as possible.
Yeah, and make sure you swing by the week before Thanksgiving. They're giving away pumpkin pies, and they're huge. They're like this big. So we'll talk about that as we get closer to Thanksgiving. But we have a guest here, and Kinsey, who do we have?
This is Water. He is 3 months old and he's ready for his forever home. We've had quite a few cat rescues recently, so lots of cats up for adoption. And he is just the sweetest thing. He's falling asleep in my lap right now.
So now where can we find Water at?
You can find Water at our ARL main location, and we also have him and other cats on our ARL website. So yeah.
Which is?
ARL-Iowa/adopt.
Okay, there you go. There's ARL-Iowa.org.
Yes, /adopt.
Wonderful.
Yeah.
Kinsey and Water, thank you so much. One more time, Dr. J, people want to take advantage of your $49 special?
Absolutely. Give us a call as soon as possible. 515-335-VERO. That's 8376. I really implore people to get in as soon as possible. Don't let this condition continue to get worse and worse and worse, harder and harder to treat. The sooner you can get in, the better we can help you get better results. You know, enjoy time with your cats, your dogs, your family members. The holidays are coming up. You probably got lots of family activities. You don't want to be held back by your health. Get in. Let's do something about it.
There you go. Brand new location, 630 South 50th Street in West Des Moines. We'll be right back. This is Iowa Live.